Day of the week is here, you guys. I think it might be Wednesday. And you know what that means. It's Wellness Wednesday! Happy Wellness Wednesday, everybody. My favorite day of the week, baby. And today, we got something good for you. Per usual, at least I like to think. Hopefully it can help a lot of you, whether you have hernias or not. How you can avoid them. What you do when you have them. What you can do naturally. When you should get surgery, which is always our last option, right? We like conservative care first, that's last, right? Then natural supplements, it's lifestyle, then conservative care, then natural supplements, then medication, then surgery is way last. But sometimes it's necessary. So what is a hernia in the first place? Well, we have these muscles, obviously, everywhere, right? We have smooth muscle, we have cardiac muscle, and we have fascia, things that encase the muscle, encase other things. And if you get weakness in the muscle and fascia, and they're encasing organs or other tissues, then they can protrude, the organs or tissues, through the wall of the muscle or fascia. And then it kind of comes out, and sometimes you see it and you kind of poke it back in, right? Those are hernias we're looking at, right? And we'll tell you when they're more serious and when they're less serious and But that's really what's going on here. Typically what's leaking out is adipose tissue, something like fat or intestine or both, right? And it depends where it is. But something's leaking out through a weakened wall, in simple, right? So what are the different types of hernias before we get into the treatment and this and that? Well, the most common that I at least see, and I think is the most common overall, inguinal. Inguinal hernia right about here, more common in men from heavy lifting, could be from overstraining in a myriad of forms. It could be from bearing down really hard, trying to go to the bathroom, or a chronic cough, or something of that nature. It could also be obesity. Typically it's heavy straining or lifting, and this one's more common in men. We have femoral hernias. Femoral, a little lower than the crease here in the groin. When you think of the groin, inguinal, that's pretty much what you're thinking of, but a little lower than that, femoral. This is more common in women, and this is more common in women that are pregnant or go through childbirth, right? And this actually could be a little more serious. I mean, the other one could be serious too. Many of them could be serious, but this could be more serious because it can become strangulated. And what that means is it pops through the tissues or organs, whatever's popping through that wall, right, is popping through and actually and choked. And you can't push it back in. It's not getting blood flow there. And it can get discolored. It becomes really painful. You can have nausea, vomiting. And that's a medical emergency, baby. You go into the ER right away if you have that with any sort of hernia off the get-go, right? So you got to definitely know that. What else do we got? We have inguinal. We have femoral. We have umbilical hernias, belly button. Right? And this could be from a congenital defect, something someone's born with in the umbilical ring, and it kind of just pops out, right? It could be due to pregnancy or obesity or many other things. You can have an incisional hernia. This is post-operative, and this is something that's associated with infection or poor wound healing, and it's something that typically happens after surgery, probably less common than the others. And we also have epigastric that we should mention, but nobody ever has. They're really rare. Epigastric is like mid to upper abdomen, and they're typically congenital and again very rare. So we're just gonna kind of skip through those. Hiatal hernia is the last one. This is relatively common. Hiatal hernia is when the stomach kind of leaks up through a weakness in the diaphragmatic or diaphragm wall, right? And it can kind of come up, the stomach into the esophagus a little bit. It can kind of come up next to the esophagus. It can happen in a few different ways. But a hiatal hernia is approached differently than the rest. That's just pretty much GERD, right? Gastroesophageal reflux disease, where you get the acid coming back up, or heartburn, as a lot of people know it, right? So you eat smaller meals. You don't eat close to bedtime. You elevate the head at night. That's really the story with the hiatal hernia. So when is a hernia serious? When is it not as serious? And what can I do conservatively? And what about surgery? When do we even talk about that? Well, what we want if we have a hernia is obviously to go see a doctor. Let them check you out. I'm not doing an exam on you. This is a medical advice, not intended to treat, diagnose, cure, prevent any disease. That's my disclaimer up in here. And so if you have a hernia, do that. But know this, as a general rule of thumb, if it's protruding, but it's reducible, right? So you can kind of push it back in. It's not painful, doesn't stay there, it's not getting worse, the symptoms aren't getting worse over time, it's very manageable, it's small, right? Then, you know, you can pretty much look at conservative management and treatment as an option. And that would include strengthening your core, namely the transversus abdominis serves as a corset, natural corset in the abdomen to kind of keep things in place, right? So how do we do that? A couple simple exercises would be bird dogs, right? Where you're on all fours, and we demonstrated these last week. I'm on all fours, I'm lifting one leg, one hand, right? You have dead bugs where you're laying on your back and you're going like this, you're going like that, you know, whatever. We got dead bugs, we got bird dogs, we got planks. You could do short duration. You don't want to do anything where you're really straining really heavy for a long time. Losing weight would be good. And consider a truss. So what is a truss? If you guys aren't familiar with the term, it's pretty much just like a hernia belt, right? So you could wear that while you're exercising to make sure that that thing stays in place, right? So you don't have to keep popping it back in, especially during heavy straining lifting, which you should avoid in the first place for the most part, which brings us to the next thing. What should I avoid? Even if I have a reducible, small, painless hernia, right? Whether it be inguinal or femoral or whatever it is. Well, definitely heavy lifting, especially compound movements, things like a squat, a deadlift, overhead presses, really heavy, and definitely don't hold your breath while you do them. You know, we've said it when wellness, if you wanted to, you know, save your baby's life who's under a car and you got to lift it up, you go, right? You hold your breath through the whole lift, increasing pressure. It's why they use those pressure suits when they lift. But with a hernia, that is not a good thing. That was just for performance, right? You breathe after, right? You definitely have to breathe after in between each rep a lot, and then do it again if you're doing it for performance. But, you know, if you got the hernia, that's just a really bad idea. You don't want to compress the space, and you don't want to increase pressure, right? So that makes a ton of sense there. Because if you're increasing pressure, that thing's going to leak out easier, right? So you definitely don't want to do that. You don't want to bend and twist under a load. You know, that's definitely for sure. You pretty much never want to do that. And you don't want to overly strain yourself while you're going to the bathroom either. You don't want to sit there and bear down really hard. Keep breathing through movements, this and that. And again, try, you know, look at that truss if you still want to do decently, you know, moderate to heavy lifting and whatnot, right? See your doctor, they'll tell you what's going on. When do you get surgery and what do they do? Well, when you would consider surgery is when it is irreducible. It is not reducible. You cannot push that thing back in. It is out there, or you push it back, it's like right back. It's like right back, right? It's that. Also, when it's painful, especially if it's getting more painful, if your symptoms have been persisting over a long time, it's not getting any better, and especially if it's getting worse, right? And especially, can't emphasize this enough, if it's strangulated. If it's stuck out there and it's just getting choked, and again, there's no blood flow to it, this tissue is getting damaged or dying, obviously it's a really bad thing. And if that's happening, you got to go to the ER, right? It can be discolored, it's probably extremely painful. Again, you could be throwing up, you could be nauseous, it's no bueno, go right to the hospital, right? So what are they typically going to do if they're doing surgery? Well, they'll put a mesh over it, right? They'll look at where the weakening in the wall is, and they put a mesh there, an artificial mesh that kind of hold everything in place. Honestly, is a great prognosis with that surgery. It's very safe, and it typically lasts people for a very long time. You know, you should be good so long as right after they do the surgery, you follow the doctor's instructions, the surgeon's instructions, and you don't overdo it right after surgery. You don't go out and lift heavy weight or anything like that right away. Now, typically the protocol after surgery, and again, you listen to what the doctor or surgeon tells you, but typically they'll let you walk right away. They want you to move, right? You know, low impact movement. So walking is typically a good thing, almost always, right? No matter what we're really talking about. And, you know, you'd avoid strenuous activity or heavy lifting for anywhere from 4 to 6 weeks typically, but it could be up to 8 to 12 weeks if it was a larger area that was herniated. So that's what we got for you guys today. Yeah. And we have birthday. We have a couple birthdays, I think. Let's think. I know we got Jill's birthday today. Happy birthday, Jill! Happy birthday to you. And you're damn right, we're gonna definitely be singing to you. So this is for you. Adam Young, I think it might be your birthday too, so we're singing to you. Happy birthday to you. Happy birthday to you. Great acoustics in here. Happy birthday, dear Jill and Adam. Happy birthday to you. So many more. Hope you guys had a great day today. And this one is for you and everybody else out there who's got hernias or knows someone who does. Frank, what's up? Meg, how you doing? Beth, Dread Blood, Davro, Dave Beast from the East. What's up, killer? Sibia Shell, what's up? Kovono, Yasmin, how you doing? And Stephen Apple Blue, OG up in here, always on. And Frank and OG as well, many of you others, as for now. So we got for you, folks. We'll see you next Wednesday, baby. I'm not sure where, not sure when, but you're damn right we'll see you then. Have an amazing rest of your night. Thank you so much, and happy Wend Wellness. See ya.